So who are you?
So I'm James Kaufman. I'm a scientist at the IBM Almaden Research Center in San Jose.
And it's a real privilege to come here because this is the place where the first hard drive was developed and a whole bunch of historical stuff.
That's
I
true.
mean, I was just looking downstairs at the first hard drive. It's pretty crazy. But you're doing something in that I wouldn't really expect IBM to do, but now that, as we talk, it'll become apparent why IBM is having you do this. But what are you working on lately?
So we're working on healthcare, electronic health records, and also public health.
Yeah.
So the same technology that we need to have electronic health records should support the needs of public health.
Yeah, and of course, I just interviewed some doctors for something else tangential to this, but they certainly see that there's efficiencies to be gained by having electronic records. Because, for instance, I was up in Seattle. I was in the hospital for a reason, and my doctors can't have access to those records until I actually release them and get them sent down, and they're all in paper form, right?
But even in electronic form, there's a difference between having an electronic medical record system in a doctor's office or in a clinic and having an electronic health record. So you need to use the internet as your model. People have to adopt a common set of protocols, a common set of schemas, data models, so that we can share data between systems and access our records. And the good news is the standards for that all exist.
Yep.
All right. And
the bad news is nobody's using them.
And actually, the other good news is most of the vendors know how to do it. They're just not selling it because there isn't a strong interest in giving you the tools that you need to move your data out of their systems.
Yeah.
Right. But the fact is, they all participate in events sponsored by organizations like the IHE and RSNA. They're called the Connectathon, and they demonstrate that they know how to do it.
Yeah.
And there are some countries in the world, like France and Canada, that are basically asking them, if you want to sell technology here, please support the standards.
Yeah. Well, I've been following a little bit about the healthcare industry. Now with President Barack Obama, there's a lot of focus on, can we get the cost of healthcare down? That's one thing, and I bet that's going to put a lot of pressure to improve the efficiency of information. So that if we can make the healthcare system a little bit more efficient, we lower the cost of it, right? And then we can get more people insured.
I think, so optimistically, I think it's absolutely reasonable to think that technology can help lower some aspects of cost. But it can do other things too. So if you think about the world of paper banking and the world of electronic banking, there's all sorts of commerce that's possible now that you wouldn't have dreamed of in the 1950s.
That's true.
Right.
I can go to Starbucks with a credit card and buy a latte, and I remember when I started doing that, and people looked at me very strange, and now it's commonplace, right?
Exactly. So hopefully there'll be entirely new models for delivery of healthcare, and healthcare will get better because if you have information, then suddenly everybody becomes part of a medical trial. So medicine will become more of a science.
In fact, to tie it into the financial system, there's a company called Mint now, which takes all your credit card bills and is looking at your buying behavior and tells you, hey, you paid too much for this card, or you paid too much for or you could save money on your car loan by taking it over to this bank because they'll give you a 4.9% loan instead of a 6.4% loan that you're paying. And by looking at all your data, it can tell you that something's cheaper or better, right, based on the crowd that it's studying.
Awesome.
And so healthcare is the same thing, right? You could be looking at my my prescriptions, for instance, and say, hey, you're buying this drug, you should be buying this drug for less money, and you could save money. Right. Is that what you're thinking of?
Well, I mean, those are some great examples. I'm also thinking more from the research side, just how it'll improve our understanding of the treatments that we're using, the interactions. I mean, as people age, they take 6, 7, 8 prescriptions concurrently, and there are no studies that look at the complexity of that.
No, that's why I was talking to the doctors over at Stanford, because they're using a tool called Hippocrates on their iPhones, so that they can plug in, this drug, this drug, this drug, and it warns them if there's an interaction because they said that, one doctor said, everything I learned in medical school 30 years ago is totally obsolete. He said, none of the modern healthcare has anything to do with what I learned in school. And it's changing so much faster today than it was back then. And all these drug companies are coming out with new drugs, new ways of treating diseases and whatnot, that I can't keep up. There's no way a doctor can keep up. You need this kind of tool to tell you what the latest diagnosis is for a specific disease, what it looks like, what the latest treatments are, and then what the latest drugs are to
Right.
solve that.
But that means you need to be able to get the data in and out of the system. So
Yes.
if we just have silos, it may be more efficient than paper, but it doesn't achieve what everybody really wants to achieve, and they call that a longitudinal EHR,
Yeah.
electronic health record.
And then before the camera came on, you were talking about pandemics, and to be able to study the how a new disease is coming online and how it's traveling through the population. Because tell me a little bit about what you're thinking about there,
so
and then we'll wrap it up and see what you guys are all doing.
Public health is about protecting the entire population,
Yeah.
as opposed to healthcare where we look at individuals. And obviously there are chronic diseases that public health officials are concerned with, but there's also emerging infectious disease. And the animal population is the reservoir for most emerging infectious disease, and there is mixing, and there are viruses that move between humans and animals and humans,
Yeah.
and every now and then that causes a pandemic.
So we hear like bird flu or even AIDS, really.
SARS, AIDS came from simian HIV in Africa, from hunters, where a large fraction of their meat are apes and monkeys.
Yeah.
And many of the hunters in Africa still have the simian version of that virus. And it took a while, but eventually it mutated and was able to spread among humans.
Yeah.
So the difference today is we live in a globalized society. So the speed with which a highly contagious emerging infectious disease is going to spread is potentially a lot higher.
Yeah.
So if you look at we're using the 1918 flu as an example.
Yeah. In fact, what is this on your screen?
So this is a picture of the Liberty Loan Parade from Philadelphia. This took place in September of 1918.
Yeah.
And public health officials warned the city not to have that event. But it was a fundraiser for World War I, so they had it anyway. They knew there was a risk of the Spanish flu. You can see from the picture that people were stacked 20, 30 people deep. Hundreds of thousands of people came out, and within 30 days, over 100,000 people in Philadelphia were dead. So the deaths from the Spanish flu, it's like all of the deaths that are going to occur in a year happening within a month or two. And in 1918, it took a while for the virus to spread from the East Coast to the West Coast. The West Coast actually fared a lot better because we had a good public health system in place. We'd been through the earthquake of 1909, there was warning, and so people had time to plan and put policies in effect. With globalization, we're not going to have that time.
Yeah.
So we have to ask, what tools do we have? And one of the only tools we have is IT.
Yeah.
And so if we can give public health officials and doctors an internet of healthcare, some appropriate privacy-protecting system that will allow them to be aware of the health of the population and the state of disease in the population, then they can use other tools to make plans and respond on a time scale where the response will make a difference.
That's interesting.
So one of the groups we're working with is called the Middle Eastern Consortium on Infectious Disease Surveillance.
Okay.
This consortium includes the Ministries of Health of Israel, Jordan, and the Palestinian Authority.
Yeah.
So they're working together because they have to. These are physicians. They're responsible for saving lives and taking care of people, and they understand this threat. So
I was actually in the hospital in Haifa,
Mhm.
and they actually treated the Palestinian victims from the wars that are going on, right?
That's right.
So, and they get, in fact, the hospital there is really interesting. They're building an underground bunker where they can treat people because they were bombed during the war and having to treat people while these missiles are flying,
Right.
100 yards away from their building. Luckily they weren't hit, but
Right.
they are planning now on getting hit in a future war, right?
Yeah,
so
so
it's
they're-
crazy world over there. But
So what we did with them, and it was
Yep.
sort of an experiment, IBM calls it a first-of-a-kind project. We took the same technology that implements the standards for clinical health records, and we adapted that to the public health use case in the Middle East.
Okay.
So they were interested in collecting data on certain foodborne diseases and on avian influenza from 8 to 12 sentinel laboratories in each country. They had central laboratories that would do serotyping and antimicrobial resistance. And And so we adapted a system that we worked on for sharing clinical records to that public health use case,
Yeah.
and deployed it there. So it is possible. You really don't want to have a separate reporting system for reportable disease to the CDC,
Yep.
and a separate system for your health records. You want the EMR that's running in the hospital to be able to supply you with data for your personal health record.
Yep.
You want reportable conditions to be automatically detected, right? So there are medical codes, SNOMED, LOINC, that have ontologies that allow a machine to recognize the doctor just diagnosed Ebola.
Yeah.
That's a reportable disease. I have a rule that says so, and so I'm going to notify the state health department, right? And that should just happen like that.
Yeah.
And it's not a technology problem, right? We do this all the time with banking, with tuning up your automobile.
Oh, yeah.
We just need to do the same thing in healthcare.
They can look at fraud rates, right?
Right.
Instantly. They call you up and say, hey, your credit card, you didn't even know that your credit card was stolen from you, and they call you up and say, hey, we're seeing weird stuff happen to your credit card, are you really charging,
And even if it's just because I took a little trip, right?
Yeah.
I mean, so they can pick it up right away. It's
Yeah.
great. And so the other thing that we're doing is to try to lower the barriers to adoption of the standards. So we're contributing to open source tools that any software vendor can use for free, to allow their applications use those pieces of the standards that they need, so they could submit documents to a health information exchange or a health record bank and get one back.
Wow.
Get documents back. So we've been doing that for a few years. Some of those open source tools were used in a project IBM did for the Department of Health and Human Services, where we were one of 4 companies that prototyped what was called the National Health Information Network.
Yeah.
And some of the hospitals, there were 7 hospitals involved, they had custom software. They had EMRs, they wrote it themselves, and we were able, using the open source tools, to go in and just research help them within a matter of a week to make it possible for them to share documents.
Very cool.
There are different levels at which you can share data,
Yeah.
but this can be done. It's not a technology problem. We just need to have the will and the determination to do it.
So what is your work like? What are you working on daily?
So my work involves actually managing some of the activities we were just talking about.
Yeah.
We're also creating another open source tool called the Spatiotemporal Epidemiological Modeler.
Well, I'd say that 10 times
fast. We call it STEM.
Yeah.
It's an Eclipse application. I can show it to you.
Oh, that'd be great.
So it uses the OSGI framework, and it's a framework for modeling infectious disease. So once you have all this data, so you know the health of your population, you know the distribution of different infectious diseases, you'd like to be able to forecast what's going to happen next.
Yeah.
And forecasting disease is much like predicting the weather. There's a mathematical model that will describe what will happen. The difference is that, unlike the weather, where one set of equations can describe everything, we have one planet, one atmosphere, every disease is different. The vectors of infection are different. If you're talking about avian influenza, you need to know about migratory birds. If you're talking about hoof and mouth disease in cattle, you need to know where the cows are. And of course, you have to know where humans are and how they move. So the power of this framework is that it uses a component software model. So everything is a plugin. The models, the mathematical disease models are plugins. The denominator data that you need for different diseases are plugins. It's open source, so people with different expertise can all contribute. And then Eclipse gives you a drag and drop interface, so you can compose models. Models can contain submodels, and therefore it gives scientists a way to collaborate, to extend each other's work, and it can all be open source. So instead of government funding a multi-million-dollar computer modeling effort where what the result is a few scientific papers, you could imagine a world in which scientists actually can publish their code to open source.
Yeah. Back to this picture, because this picture is an amazing story. Is there going to be a place that we can study where not to go, or or know what the latest diseases are that you guys are seeing after you build such a system, so that we know not to go to that parade, or the modern day equivalent? Because I do a lot of traveling, right? It's like, if you know that there's a certain disease that's going nuts, and China, don't go to China, or don't go to California.
I think the question is one of data ownership and when things get reported. I mean, a lot of public health involves tracking chronic things, seasonal influenza, we know it happens every year,
Yeah.
anticipating the next year. When something new happens like SARS, it took a long time for the central government in China to find out what was happening at the local level.
Yeah.
All right, so there's a question of how people behave. Every country in the world is a member of the WHO, and they've all signed up on an agreement that says what things are going to be reported up to the WHO, but it doesn't always happen the way it should.
No.
I think you can give people tools, technology can make it more efficient, but you still depend on people doing the right thing.
Yeah. No, absolutely. Is IBM, or are you working on the personal kind of health systems that we're going to start using? Because, for instance, I was just diagnosed with a weird kidney disease. They don't even know what the disease is. They just know my dad has it, and I'm showing the same symptoms. And so I'm going to the web and starting to put in, all sorts of information, and other people are telling me what they're seeing or what they're hearing from their doctors. And that's very powerful, because now we have a way to make sure that we're getting the best medical care, even though we might not be in the right region or at the right doctor or whatever. We're sharing information personally, right, out in the public. It's really crazy what's going on. I mean, you know, but is IBM looking at doing a system like that for the public?
IBM is a big place.
Yep.
And I don't want to claim that I know everything that IBM is doing, but what I do know is that we're focused on working with many of the application vendors that do this.
Okay.
And so particularly here in research, what we want to do is to help all
Because
of
Google and Microsoft both have those public...
They actually have what they call personal health records, or and I think there are different business models in the different cases, but they're running services like that. And what IBM and IBM Research is trying to do is to encourage people to implement the standards. So there doesn't have to be just one winner here.
Yeah.
We don't want a world where everybody goes to one company and that's the source, the sink and the source for all health records, right?
Yeah.
We'd like to see a world that's more like the internet, where there can be different models. You can have, in some countries, the central government will be a health record bank. In the U.S., it may be different. There might be different choices for who's going to host your records.
Yeah.
But you'd like to be able to move them and control them and set policies and use them for your own research, as well as perhaps allow scientific
Absolutely.
research.
There's 1,000 flowers bloom, and it works a lot better. So can I see some of the tools that you're working on?
Sure. Would you like to see STEM?
Sure.
Okay.
STEM's a lot easier. What does STEM stand for again?
So STEM stands for the Spatio-Temporal Epidemiological Modeler.
Yeah, I'm not going to say that
This is
very fast.
Eclipse. This is Eclipse.
By the way, who are you? 'Cause you're-
Hey, Sarah.
it's PR firm. PR for IBM.
And like Eclipse, STEM uses the OSGI framework, so everything is a plugin. And STEM has different perspectives. It has a designer perspective that allows you to compose new models and new scenarios.
Yeah.
So here, for instance, is a project explorer where you can create a project and study a disease in some region of the world.
Right.
And here I'm showing you one scenario, and that scenario contains a model.
Yeah.
The model contains other models, in this case the model of the State of Israel, the model of the Palestinian territories,
Yeah.
the common border relationships between them, and a mathematical model of the flu. And Eclipse allows you to compose these with drag and drop.
Yep.
And here we've been, these
Pretty
are...
much standard stuff.
Right.
And a lot of people are familiar with Eclipse.
Right, and then there are other objects that allow you to set the state of your simulation. So on day one, how many people have the flu in different locations, how many people are resistant to the flu, all right?
Wow.
Once you have your simulation configured, and if you download STEM, it's available through the Eclipse Foundation, so it's open source. It comes with some built-in scenarios that you can just run, so they're all set to go. So this is an example for the United States, where we're starting with a Spanish flu in Middlesex County, just outside of Boston.
Yeah.
And in 1918 there was no air travel, so there's no air travel plugged into this model.
So this is
These
all
are the
counties.
counties. There's over 3,000 counties in the United States, and
what do the colors mean?
so the colors represent, blue represents the number of susceptible people.
Yeah.
So here you can see the susceptible population. Everybody starts out susceptible because there hasn't been a flu.
Right.
And E represents people that are exposed but not yet infectious.
Yep.
And let's just turn on a little gain factor. So it takes a little while for the integrator to process time, but you can see we're up to 20 days right now.
Oh, so it's processing all that modeling and coming up with
At
each day what's going on.
Because we told it to go one day at a time.
Okay.
And R, which might be a little easier to see on your camera, I, which is red,
Yep.
represents your infectious population.
And
so
you're
now you can see
just
that
starting up.
it's just started up, and it's going to spread as a wave.
It's hard to see on my camera,
Let me
but
see if I can zoom in for you.
no, this is good stuff.
Okay.
So what day are we on right now?
So you're on the 33rd day.
33rd day.
And then you can also visualize the edges. So in this case, we have roads, we have common borders.
Yeah.
So here I'm just going to show you, these are the common borders that determine what counties are adjacent to other counties.
Right.
All right. And depending upon your model, you can use different different edges, different vectors of infection.
Now, this is studying what happened actually back in 1918, right?
This is actually a simple demo. It's not. I would not say that this is an accurate model of 1918, but
Okay.
the parameters for the flu are what you'd find in a textbook for the flu.
Now, today we have air traffic, right? So
Right.
this thing can go over to Europe in one day,
It would
couldn't it?
spread through the air transport system in a matter of hours, if not days, if not hours.
Yeah.
So you would rapidly see it appear at the major transportation hubs.
Whoa.
So then STEM also comes with an analysis perspective. I'll just stop this for now.
Now,
Which allows you to compare, and I won't go through all the details, but it allows you to compare models to data, models to models. So we're working with public health officials that have data, 10 years of influenza data at different locations in one country, and you can then take that data as a starting point and say, okay, what parameters should I use in a mathematical model so that I can actually accurately represent the data and then hopefully eventually forecast and say, okay, if it's an H3N2 flu next year, what's the susceptibility of my population right now?
very cool.
So that's the idea.
Cool work. Where can we learn more about what you're working on?
Well, you can learn about STEM from the Eclipse Foundation, and IBM has some external websites that you can go to learn about some of the public health work in general.
Okay.
There's an organization called OHF at Eclipse, the Open Health Framework. There's a new open source organization called OHT, and you can read about OSGI, the Open Service, the OSGI Alliance on Wikipedia. So.
Very cool. Well, thank you so much.
you.
This is really great stuff.
Okay.